Hello everyone, this is Dr. Zibi. For those who don't know me, I am a psychiatric mental health nurse practitioner and also a substance abuse provider. So I want to thank you all for listening. Today is a short video. I want to talk about the sign of stress and anxiety in children. Okay, as a provider and as a mother, I believe identifying these signs as soon as possible is very crucial because that's what is going to help us to provide to those kids the help that they need. Okay, so what are the signs that a child can have when he or she is anxious? Some of the signs can be behavioral, and those behavioral can be restlessness or hyper activity. So some kids become very hyper and unease and unable to stay still. Another behavioral change that you can see is clinginess. Clinginess just means that the child is having separation issues. He doesn't want to, he has this fear when he's getting separated from you. That can also be a red flag. Another red flag can be irritability and mood changes. Okay, your child can start having temper tantrum or anger outburst. Okay, and all this depends on the baseline of the child because you need to know your child baseline. Okay, so when you see your child becoming very angry, having outbursts of anger or having temper tantrums, and he wasn't having those behavior, then it's a red flag. All right, we have withdrawals. A lot of children, when they become stressed out or anxious, they start avoiding social interactions with peers or with family members. Those are the behavior changes that you can see. And now going to physical changes, the first physical change that you can see is sleep issues. Some kids, when they're anxious or stressed out, they start having changes in sleep patterns. They start having difficulties falling asleep, start having nightmare or even difficulties staying asleep. Okay, that can be a red flag. Appetite changes. Some kids, when they're going through stress and anxiety, some of them, they may start eating more than often. Okay, they may start eating, and when they eat a lot, they eat more, they're going to be eating junk food. All right, and some may not eat at all. Okay, the other physical symptoms that they can have can be frequent complaint. Mommy, I have headache. Mommy, my tummy hurt. Mommy, I have this pain, I have this achy. And sometimes those pain and aches are even unexplained. All right, your child also, as a physical sign, can be very fatigued. And fatigue, you don't want to do, you have low energy, you don't want to do anything, you just want to sleep. And sometimes parents don't understand that you just want to start complaining about the child being lazy and all that. Okay, so you need to know your child, you need to know the baseline of your child. All right, so when you see any changes, you need to monitor that child and see if he's going through something. All right, some of the signs of stress and anxiety can also be emotional indicators. There's some emotional indicators that be excessive worry, fearfulness, and sometimes a lot of sadness. Okay, the child becomes very sad and tearful. To know when your child is stressed or anxious is the difficulty concentrating. A lot of children, when they're going through stress and or anxiety, they have trouble focusing on tasks, and that also is affecting their school because when you can't focus, you can't concentrate, you cannot do your homework, you cannot even follow your teacher, you will not do good. Your grade will start declining, and your academic performance is going to be very bad. Right, the child can start having negative thoughts. Negative thought is thought of hopelessness, thought of low self-esteem. A lot of kids, when they cannot accomplish certain things, they start feeling like they're a failure. Okay, self-criticism, they start criticizing themselves. Those are red flags. When you have a child at home and you start having those things, the child may start overthinking about stressful situation and potential problems. All right, so some of the child also can also start having increased conflict with peers. Okay, They start having conflict with peers, start having conflict with siblings, and also have conflicts with authority figures in school. They don't listen to the teacher, they don't listen to the leaders in school. They don't, they don't even want to follow instructions. So I'm gonna stop there right now, and in conclusion, I believe recognizing these signs of stress and anxiety in children is the first step as provider and as a mother towards helping our children. Okay, I believe early intervention can prevent more severe mental health issues from developing in the future. So the call of action that I'm going to send is, if you notice any of these signs in your child, talk to them. Take the time to sit down with those kids, because a lot of parents don't have time to sit with the children. They work a lot, and the children go through all this without being heard. All right, so you need to sit down with the kids, talk to them, let them throw out their feelings, and if you need help, seek support from a mental health professional. That's why we're here, okay, to help you. All right, so I want to thank you all for watching. I hope this information help you support your children or the children in your lives. Okay, and if you need help, if you need help from a mental health professional, my phone number is 240-253-3912. I'm a mental health nurse practitioner. You can text me, or you can call me, and I will be available. All right, so thank you so much for listening. I hope this information help you, and I see you next time. Thank you. Bye bye.